Hi, William. How are you doing today?
Good.
Good. So today we're going to be talking about your extraoral and intraoral assessment, and we're going to be talking about your oral health. And we're just going to talk about plaque, and we're going to just talk about like brushing as well.
Okay.
So we do see that you have a plaque score of a 3.5, which indicates that you do have a poor score. This indicates as well poor oral health. We also see a 62% of bleeding score. This indicates that you do have generalized bleeding kind of all over your gums, so you are bleeding a lot than normally. And we also see that you do have gingival recession, which is usually like on your gums and around this area. And it's on the top of, well, your top teeth and your bottom teeth as well. And you do have some slight periodontitis as well.
Okay.
We're going to be talking about plaque, and I'm going to be showing you some pictures as well so you can kind of get a visual. Are you familiar with plaque?
No, I am not.
Okay, so plaque is just a sticky white film. It's bacteria. It usually forms whenever you're not brushing your teeth right, whenever you're not flossing right, whenever you're not flossing at all or brushing at all as well. Do you know where it usually forms?
No.
No, so it usually forms around your gums. It can form on your tongue, at the roof of your mouth, and just around your cheeks, pretty much all over the mouth. And it forms around 4 to 12 hours, I would say, after eating or drinking sugary drinks. Do you know how it is removed?
No.
Okay, so it's removed twice daily and by flossing once a day as well. Whenever the plaque has progressed, it can lead into calculus. Are you familiar with calculus?
No.
Okay, so calculus is like it's a yellow or brown rough bacteria buildup from plaque. So it's just plaque buildup pretty much. It forms whenever the plaque is not removed and improper oral health as well. It can form as soon as 2 to 3 days, and this is not, unfortunately, it is not removed by brushing anymore. You would have to go to a dental professional. So these are some pictures right here that I have pulled up for you so you can see. So plaque right here, this would be, this is plaque. This would be the sticky bacteria that kind of forms in the middle of your teeth and in your gums. And then this right here is whenever it becomes calculus and it is hardened.
Okay.
Do you have any questions so far?
No.
Nope. Okay, so now we're going to be proceeding into the goals that we have set. Just kind of see if you're going, if you feel like they are going to be attainable for you, if you can incorporate as well, and just kind of try to help us lower your plaque score down and your bleeding score so we can have a better score for your oral health as well.
Okay.
So I want to review these and make sure that you are willing to compromise as well and help us and help your oral health. So we have made some appointments for you so you can return back at the clinic and we can do like some quadrant scalings, and we have set a goal for 3 appointments.
Okay.
So for the first appointment, we're going to understand what plaque is, which we're going to be talking about, well, what we talked about already, and just kind of go over what we just went through and make sure that you do understand what I went over with you. We're going to decrease your plaque score by a point or more each visit, and we're going to demonstrate you proper brushing technique as well. For your second appointment, we're going to understand what periodontitis is, which I mentioned in the beginning that you do have slight periodontitis. We're just going to go over it and kind of get you familiar with what it is. And we're going to tell you what causes periodontitis. We're going to reduce your bleeding score by 20% each visit on your second visit. And we're going to demonstrate you proper flossing techniques, and we're going to start flossing once a day by your next appointment, hopefully. And this would be all by December 1st as well. And we are on your third appointment, we're going to be talking about understanding what cavities is. So I did also see that you do have cavities on 3 teeth, the dentist mentioned that you did have 3 cavities. So we're going to be getting you familiar with cavities and what a diet can do to prevent these cavities. And we're also going to make an appointment with a dentist for your cavities so they can be restored. And then you will begin using fluoride rinses by that appointment.
Okay.
So I just want to double check, make sure that you are going to be cooperating with us and this is going to be attainable for you. Are you going to be able to show up for these visits?
Yes, ma'am.
Okay, and just making sure, I would like to also, so we're going to be working as a team. I'm going to be setting these goals for you, and whenever you come on your visits, I'm just going to be going over this, and we're going to try to lower this Plaque score. But I do need you to be able to do your part at home, so we can kind of compromise and we can lower these scores.
Yes, ma'am.
Okay, well, good. So now we're going to go over what I went over with Plaque and calculus. So do you remember what it is?
Yes. So
Okay.
basically, Plaque is before it gets formed to calculus. Basically, not as sticky or gooey as calculus, but that's before Plaque is before calculus, right?
Yes.
Okay.
And the Plaque is what's the soft and sticky.
Okay. Yeah.
So whenever calculus it progresses, and calculus it is the hardened.
Hardened. Okay.
Yes. Are you familiar with how these both? How does it form?
Yes, but drinking soda, sweets, but anything with sugar.
Yes. And are you familiar with how to remove the Plaque?
You can remove Plaque by flossing right and brushing right, but with calculus, you can't remove it. You gotta go see a professional dentist.
Correct. That is
Okay.
correct. Okay, so seems good, and I do see that you are willing to cooperate with us. So we are going to, for this appointment, we are going to decrease your Plaque score, and we're going to now demonstrate you the proper brushing techniques.
Okay.
So the main initial goal for these 3 appointments is to decrease your Plaque score by to a 0.5 by the end of all these sessions as well, and to have your cavities restored and to help not furthermore the progression, just stop the progression of your periodontitis, and by reducing your bleeding score to a 0 as well by the end of these appointments. Does that sound good to you?
Yes.
Okay, awesome.